Asepsis. What is asepsis? Asepsis is used to prevent microbial contamination during an invasive procedure or a breach in the skin. So we're not worried as long as there is no breach in the skin. But when we anticipate any breach in the skin, we have to prevent microbial contamination, and the procedure by which we do it is called asepsis. Typically, this is practiced very strictly in the theater. And being a surgeon, I'm very much, I'm very critically aware of this when I scrub up. So aseptic technique is a set of practices and procedures designed to prevent pathogen contamination. And it involves strict adherence to protocols to reduce the infection risk. So these guidelines should be strictly followed. Otherwise, you can end up with infection. So the aseptic techniques are the techniques by which we maintain asepsis in any procedure. So broadly, this can be classified into sterile technique and clean technique. Now, what is the difference between these two? So, I think because we wanted to focus on ANTT, I'm not going too much into detail except giving a few markers or pointers towards these two. So, sterile technique is used to eliminate all microorganisms, including spores, from the procedure site. And the only way we can use it is by sterilizing the equipment, which also kills the spores. So, this is typically used in the operating theater. Whereas a clean technique is also an aseptic technique, but it's modified because it has to be used at the bedside, and we have to accept that this does not eliminate all the pathogens. So that is the clean technique, but still we need to use certain strict technique to make sure that asepsis is maintained in clean technique. So here is the table which gives the difference between sterile and clean procedures. Starting from gloves, sterile, you have sterile gloves, and in clean procedure, clean or non-sterile gloves can be used. Equipment, as I said, all the instruments must be sterilized. Here, clean but not sterile instruments and equipment are used. Contact is always sterile to sterile. So, you cannot compromise on this in sterile procedure. Whereas in clean procedure, it can be from clean to clean or clean to sterile. So, for example, if you're putting dressing onto the say central line, your hands are only clean. You don't wear a sterile gloves, but you're using a sterile dressing to put the dressing in the over the central line insertion site. Environment is a sterile field such as operating rooms. Here, clean it is less controlled, like in patient wards or homes. And the purpose is to prevent infections, including spores, and in high risk or invasive procedures. Here, it is reduced infections for procedures that are lower risk. Common use, I think we are all very familiar. In surgical theaters, invasive diagnostic and treatment settings like invasive interventional radiology. Here it's non-invasive in outpatient clinics, in the bedside, in the ward, and home care. And examples of surgical procedures: catheter insertion, wound suturing. Here, basic wound care, dressing changes, taking vital signs. Okay, so that's just a bird's eye view of sterile technique versus clean technique. Now, let's get into aseptic non-touch technique, otherwise known as ANTT. So, it is a standardized method used during a medical procedure to prevent infection. So, it actually combines all the aseptic techniques into a stepwise manner, and somebody has been clever enough to put everything together and give it a name. So, and also it is a registered trademark. So, we do it all the time. It's nothing new. I'm going to tell what we are going to discuss today, but it is sort of being put in a nutshell and presented in a stepwise manner, and that is what makes it very unique. And I think this is a very nice way to present the technique that has to be used at the bedside or in the operating theater. So where is it used? As I said, all sterile procedures done in the OT, the aseptic non-touch technique is used. Clean procedures, for example, changing a wound, maintaining a surgical drain, IV cannulation, and also limited sterile procedures done at the bedside. For example, urinary catheterization, central line insertion. I want to pause here to bring your attention to these two procedures. So these two procedures are actually sterile procedures. If you're putting a line into the central vein of a patient, where you are putting a catheter into the near the heart, then definitely it has to be done in a sterile way. And because it is done at the bedside, somehow the sterile technique is diluted and downgraded. And that is the reason we get CLABSI. The same thing holds true for a urinary catheter. The bladder contents are sterile. And apart, a few centimeters from the meatus, the rest of the urinary tract is also sterile. But again, because of the environment in which is disused, the sterile technique is again not maintained fully, and therefore, we get incidence of clotting. So this is now why this technique, ANTT technique, will be very useful to reduce the infection rate in the bedside. Because already in theater, the ANTT is used to the maximum extent. So now, how does this technique reduce infection? People may think, what is this new thing? Just some fancy word, jargon, which you're using. But it is actually very useful because it ensures that the key parts of the equipment and the key sites of the patient body remain uncontaminated. Ultimately, this is what you want to achieve, isn't it? You want the part of the instrument or catheter or whatever, which is going to go through the skin, or which has the potential to go through the skin, should remain sterile. And the area in which you are going to make the breach to get underneath the skin should be sterile and uncontaminated. Oh no, so this is the thing. So key parts and key sites we will talk in detail, but remember these two words and the relationship in ANTT. We need to ensure that the key parts of the equipment and the key sites are uncontaminated. So key components are the key parts and the key sites. Now, what are these key parts and key sites? So key parts are components of medical equipment that come into direct or indirect contact with patients' susceptible sites and therefore result in infection. So you can see the tip of the hub, if it is contaminated, can transmit the infection into the bloodstream. So similarly here, and the needle hub, the syringe tip. So all these things are known as key parts. And you need to either keep it sterile, that is when you open the wrapper, this part should not touch anything else. Or if like the hub which you're using in the Q site, the needleless connectors which are using in the IV cannula, if you're going to use it repeatedly, then you have to use a technique called scrub the hub, in which alcohol spirit swab is scrubbed for 15 seconds, and then it is connected to disinfect these areas. So the key parts are very important. So other examples of key parts are the tip of the syringe, the needle tip which goes into the skin, the hubs and caps which we use in IV therapy. And then in the central line, it is the catheter tip and the hubs here. I think I should use the laser pointer. The catheter tip here and the hubs, these are potential areas which can cause contamination. And similarly, in the urinary catheters, the tip here and the connecting points here, which are the key parts. The dressings are also key parts because as long as the dressing is covered with a sterile wrapper, it is fine. But once it is taken out, then it becomes contaminated. So as much as possible, we should try and keep the dressings within the wrapper. Now, that's about key parts. I hope I made it clear. Now, key sites are the areas in the patient body that are at risk of infection during a procedure. Now, what are key sites? These are areas where there has been a breach of skin. Either it is a wound or unintentional here or an intentional surgical wound, or the site where you insert any cannula or puncture sites to take blood. So that also is a key site, and I already told you surgical sites are also key sites. Now, based on this, we need to have an aseptic field. So if you understand ANTT, the principle is to keep key parts and key sites as uncontaminated as possible. So to do that, we need to create two types of sterile field. One is called the general aseptic field, and another is called the microcritical aseptic fields. Now, what are these? So the general aseptic field is the area in which these equipment are kept, typically on a tray. So that is why if you see every procedure, we keep emphasizing clean the tray with an alcohol swab and then collect the items. So cleaning the tray with the alcohol swab and drying it creates the general aseptic field. It reduces the microbial population in the contamination in the inside of the tray. So that is a general aseptic field. And how you place the syringes and needles and other equipment in the tray is to maintain the microcritical aseptic fields. Now let's look at these. So what is microcritical sterile field? This is where it is a small controlled sterile area where it is impossible to replicate, where it is used where it is impossible to replicate as fully sterile equipment. If I use the same things in theater, what the nurse will do, she will open the wrapper and drop the syringes into the large sterile field, which is the sterile trolley she's got. And because it is a sterile trolley, these syringes and needles can be dropped into that sterile field. That happens in the operating theater. Whereas in the ward, you don't have such a sterile area in a trolley. It is impossible to replicate that. So that is why you create a general aseptic field by cleaning the tray with alcohol swab, drying it so that it gets disinfected, and then you don't drop the syringe. You open the syringe wrapper and take out the syringe, use it to load the medicine, resheath the needle and put it back into the syringe. We always say don't resheath the needle. But here, to maintain the microcritical sterile field, we need to resheath the syringe, and there you have to use a one-hand technique. One-hand technique is getting the syringe into the cap, raising it vertically, and then clipping the cap onto the syringe, so that the needle tip, which is a key part, is not exposed. And if there is no needle, the tip of the syringe, which is the key part, is not exposed. The inside of the wrapper is still sterile, and therefore you keep it in a sterile environment. Similarly, in alcohol swab, you just tear it partially and keep it on the tray. You don't open it fully and drop it into the tray. The alcohol swab is still within the wrapper, and the inside of the wrapper is sterile. So that is how you maintain the microcritical sterile field, which ensures the key parts do not touch other areas. I hope this is very clear, and if there's any doubt, we can discuss it in the discussion. Okay, so now having understood the key parts, key sites, and the general aseptic field which is created in the bedside, which is now opposed to a theater where there is a large sterile field, and then maintaining the microcritical sterile fields by these techniques, we can now start implementing ANTT. So ANTT starts with hand hygiene, using the correct glove. Either you use sterile glove or clean gloves. We'll come to that. That is a choice. You have a choice in ANTT to either use sterile glove or clean glove. And then you need to make sure you prepare the key part and key site protection. That is how I mentioned in the microsterile critical field. And then you have to use non-touch technique. As much as possible, do not touch these key parts and key sites. If at all you have to touch, you have to then use a sterile glove. Otherwise, you can use a non-touch technique. Then you have to disinfect the key site. I'm sorry, there's a mistake here. It's key site disinfection. The area of the patient where you're going to pierce or where you're going to make the incision has to be disinfected. it may be the penis in terms of the urinary catheter, vagina in urinary catheter, the skin of the neck in the terms of the central line. This should be disinfected, and aseptic field management should be done. So these are the core elements of the ANTT. Now let's look at one by one. At this point, I want to pause and talk about this famed Cheetle forceps and jar. Okay, so the Cheetle forceps and jar does not belong to a hospital. It belongs in the dustbin. The reason is neither the forceps is clean nor is it disinfected. We put it in the solution, Savlon, whatever, Dettol, and put this thing. And after one day, if you take that fluid and send it to the microbiology lab, it will be teeming in bacteria. And with this forceps, you take the sterile gauze from the bin and do a dressing for the patient. Such injustice you are doing to the patient if you are using the Cheetle forceps and jar. Please, if you are using it, throw it away. And the way it should be, and the gauze packets and pad and all should be used, it should be in packets. It's all in, nowadays it is available commercially. You can buy the sterile gauze packets, sterile pads, or if not, get somebody in your organization to prepare this gauze, but put them into small packets. If you have a ETO, you can seal it in those packets. Put them into the ETO sterilizer and then use it. Okay, whatever way, please don't use the Cheetle jar. So you have to use ANTT. You can't say I'm using ANTT and because by using Cheetle jar. Defeats the whole purpose. Non-touch technique. No, I'm using Cheetle forceps to grab the gauze, and therefore I'm using ANTT. That is the worst disservice you can do to the ANTT technique. Now, why is this ANTT important? It is a challenge. When you're doing sterile procedures like central line insertion, urinary catheterization at the bedside, maintaining full sterile feeds is very, very challenging. And therefore, you need to create these microcritical sterile fields by maintaining the key parts and key sites. And the outcome is minimizing the infection risks effectively. Okay, so how do you maintain the microcritical sterile field? I already told you. First, you need to create a general aseptic field by cleaning the tray with alcohol swab. Okay, so that you have created the general aseptic field. Then you need to protect the key parts. You can't place them like this. As I told you, you need to place them either in the wrapper or at least with the sheath on the needle. Okay, and the alcohol swab can be, you can tear it, but they should be still within the packet, because the inside of the packet, the inside of the wrapper is sterile. Now we are now coming to looking at the two types of ANTT. As I said, ANTT is already practiced to the maximum in the theater, so that is surgical ANTT. The standard ANTT is what we use in the bedside, which is used for clean procedures and sterile procedures which are done at the bedside, and that is standard ANTT. So here, as I told you, in the surgical ANTT, there is a large sterile area. You can create it. And in that, you place all the sterile equipment, even without covering them. It does not matter because this area is large sterile field. Whereas in standard ANTT, you can't do that. You need to protect the key parts while placing it in the general aseptic field. So surgical ANTT, if the procedure is complex, duration is more than 20 minutes, large and open sites, abdomen, all this or neurosurgery, there are large sites and they're open. So you can't do standard ANTT there. Key parts, the equipment has got several key parts, or it has to be sterile. And here the example I give is assisted delivery, because this is again a sterile procedure, and most often the sterile procedure is not followed. Instead of giving a procedure of laparoscopic cholecystectomy example, I given purposefully this example of assisted delivery, where it is a surgical ANTT has to be followed. It has to be in the labor room, which should be as clean as the theater. And then the standard ANTT procedure is simple. Duration is less than 20 minutes. Key sites are small. It's either for urinary catheterization or central line. These are small sites which you can disinfect. And the equipment used has to have few key parts. Example, wound care, all these things. Now, how do I decide whether I have to take the patient to the theater or do it at the bedside? Either I have to use surgical ANTT or standard ANTT. We already saw that. Procedure invasiveness. Okay, invasive procedure. Then we have to do the as a surgical procedure. Duration more than 20 minutes. Area of key site is large. Number of key sites is more. And also the competency. Even though you may do a urinary catheterization or central line by an experienced person at the bedside, if you think that the person does not have the competency to maintain the ANTT in the bedside, it is worth taking the patient to theater and doing that procedure. Okay, so competency plays a major role. So let's get into the steps of ANTT. Now that we understood the principles, the difference between surgical and standard ANTT, now we get into the steps. The first thing is to do the risk assessment, determine whether it requires standard ANTT or surgical ANTT, and thereby deciding where it has to be done. Now, the first thing is you need to remove immediate environmental risks. So do it in an area which is relatively clean, which can be easily maintained. Don't do it near the wash area and things like that where there is a risk of contamination. So environmental management is very important. Then you need to do a hand rub and hand wash up to the wrist. This is for clean procedures. This is where the confusion is. So clean procedures are putting an IV line, doing a wound dressing, and all those things are clean procedures. Whereas a central line and urinary catheter are sterile procedures. Therefore, your hand rub or hand wash should be up to the elbow, just like you do in the theater. Okay, please mark this difference. For central line and urinary catheter, your scrubbing should be up to the elbow, not up to the wrist. And then use clean or sterile gloves and plastic apron. So this is again clean procedures. You can just use a clean glove. Whereas if you use for sterile procedures, typically central line and urinary catheter, you need to use a sterile gown and sterile glove. Just as if you are doing a surgical procedure. You should be fully gowned with the sterile gown and you should have a sterile glove with a cap and mask as if you are in the theater. This is for central line and urinary catheter. Whereas for the other clean procedures like drain care or wound care, changing the wound dressing, you can just put a plastic apron. Then disinfect the surface. So best is 2% chlorhexidine or betadine. You can disinfect the surface. And if it is, and this is creating the general aseptic field. And also for on the equipment side, I told you, you clean the tray with a alcohol swab. So you create a general aseptic field. Then collect the items with wrappers and place it on the surface. So you collect the items and place it first around the tray. Then you do the loading, whatever things you are going to take to the patient, you then do open the wrapper and place it in the general aseptic field. Covering the key parts with the wrappers and with the caps is known as protecting the microcritical aseptic field. So that is a microcritical aseptic field. So that's what I'm told. So when doing this, as much as possible, you have to use non-touch technique. So you use a sterile forceps to take when you're doing, say, for example, wound dressing, there will be two sterile forceps. So using the sterile forceps, I may wear a clean glove. So wearing a clean glove, I will hold the sterile forceps in the hand, pick up the gauze, put it in the, betadine or chlorhexidine and clean it. By using non-touch technique, what I'm doing, I am not touching the gauze, which is a key part, and I'm not touching the key site with my bare hands or clean gloves. I'm only doing it by using a forceps, sterile forceps, and using a sterile gauze. Okay, so that is the non-touch technique. And finally, you need to discard the items in the appropriate biomedical waste management. So these are all the steps of standard ANTT. For a surgical ANTT, environment, positive pressure ventilation, HEPA filters, hand hygiene, surgical scrub. Nobody asks, should I scrub up to the wrist? Everybody does up to the elbow. And PPE, sterile gloves, sterile gown, face eye protection. This is all now become the norm or culture in the theater. So there is no people just follow it. And then critical aseptic field. So instead of microcritical, here it is called the critical aseptic field, where you create a large sterile area using sterile drapes on the trolley. You remove the wrappers and drop the sterile items in the sterile field. And then non-touch technique, protect the key parts with one large main critical aseptic field and handle them, even then handle them, be careful not to touch the key parts of the equipment. So that is the non-touch technique in the surgical ANTT. And discard used items into the appropriate bin. That's the same in biomedical waste management. So you saw there are some key differences between standard ANTT and surgical ANTT. In the standard ANTT, this scrub is, the clean procedures, the scrub is only up to the wrist. And you just wear the clean gloves and the plastic apron. And you don't have a very large sterile area, and you don't drop the items. No, you put them into the wrapper. So the thing is classification. So because it is the bedside, the central line and urinary catheterization are classified as clean by some people, and that's why they are compromising. If they think it is a sterile ANTT, then they will follow all the steps in the bedside, even though all the steps which are done in the theater, even though it is done at the bedside. So this is something which we have to remember. So friends, we have come to the end of this small talk on aseptic non-touch technique. As I said, somebody was clever enough to put all the things we already know into a system so that we know what to do. What to do in theater, what to do in the bedside. And more importantly, which procedure is sterile, which procedure is clean. When you have that distinction in mind, then you follow the appropriate surgical or standard ANTT. Okay, so we talked about aseptic technique, which is preventing microorganisms getting into the area which we are operating or doing procedures. Aseptic non-touch technique, what is it? It is a set of, or you can say, procedures which you have to do to maintain as much as possible contamination on the key parts and key sites. Then we looked at microcritical sterile field in standard ANTT, where you have to take the help of the inside of the wrapper and the caps to make sure that the key parts are not exposed. And then we talked about the types of ANTT, surgical and standard. Surgical is what for sterile procedures and happens usually in theater. But also in the bedside, there are two procedures you have to be very careful about, and also include many others like burns dressing, anything which actually has to be sterile, you have to use the surgical ANTT. And then we talked about the steps of the ANTT, how from hand washing, you do all these things. Okay, so practices to prevent contamination, key parts and key sites in ANTT, focusing on protecting small sterile areas as macrocritical sterile field, types of ANTT, standard and surgical, and the steps, risk assessment, environmental management, PPE, aseptic field selection, and biomedical waste management. So I want to end before going into questions about this. I always quote this study done by Peter Pronovost in Michigan. He is one of the ICUs in Michigan, and he used just 5 steps and brought the CLABSI rate to 0. Not only in his hospital, in 18 other hospitals in Michigan, and now in all over the country and even the world. You just have to follow 5 steps. The first is doing your scrub. Your scrub should be as if you're doing in the theater up to the elbow, and then wearing sterile gowns and sterile gloves with cap and mask. The second is disinfecting. Now, first is the hand hygiene up to the elbow. Second is the PPE you wear, that is the fully gowned and gloved as if you are in theater. The third is disinfecting the area with 2% chlorhexidine. And then the fourth is avoiding the femoral sites. And the fifth is draping the patient from head to toe as if you are doing in theater. Instead of putting a small central hole towel where there can be contamination, he did a full draping from head to toe, only exposing the central line area. So these 5 steps, nothing high tech, all simple. Hand hygiene, wearing the appropriate PPE, disinfecting the site, fully draping the patient, avoiding femoral sites. He was able to bring the CLABSI rate to 0. And there are several publications. Search for Peter Pronovost, and CLABSI in Google or ChatGPT. Search, it will bring up the papers. So that's how simple it is. And we can bring even CORTI and all other rates down to 0 if you follow this technique. Thank you so much for your patient listening. Thank you. And again, thanks for the enthusiasm and encouragement you give us by joining in such large numbers. Thank you and goodbye.